topic that I chose to discuss is coronary artery disease. It is known as CAD for short, and it happens when the arteries that supplies the blood um, to your heart becomes damaged or clogged. The process of this clogging is called arteriosclerosis. It is a buildup of plaque inside the artery walls. So, people who are at risk of coronary artery disease are people who have high blood pressure, high cholesterol, and diabetes. Lifestyle factors also contributes to the overall health of the person. If a person is smoking, has a sedentary routine, and has a high sodium diet, it also increases. And there is also a research that suggests that genetics also have contributes to this coronary artery disease. So men are most likely to have this kind of disease, and women after their menopause often gets this too. So, what are some common signs and symptoms of coronary artery disease? The most common sign is angina. This is also referred as chest pain and pressure. So, you may also experience shortness of breath whenever you're trying to do activities, simple activities such as going into your room when you have, let's say, 4 to 5 stairs and making up your bed. You're always tired. This is also called fatigue. And the pain also radiates through your neck, shoulders, and jaw. And there are some day-to-day treatments, although it couldn't be cured. So, to manage coronary artery disease, we focus on four methods. It is to have medication management. If you try to go to your physician and cardiologist, they will prescribe you medication, and it is good to take it on daily basis for you to feel better. Do not skip it, of course, and it is also recommended to have cardiac-friendly diet. So eating foods that are low in sodium and heart-healthy foods such as fruits and vegetables are good for you. Less sugar and less salt is also good for the entire diet. So also try to move a lot, monitor your exercises. Let's say, for example, that you cannot really run or do some activities well because you're aging. It is better to take some 15 minutes walk, and that could help the person a lot. And people who has this heart disease will often get prescribed nitroglycerin, and it is to keep your rescue medication with you at all times, especially when you feel it in random times. And there are also emergency instructions to follow. So if the person has chest pain crisis, there are 4 steps in this. So you stop and rest when you're having this symptom or this crisis. It is important to sit down and so that you can lower your heart oxygen needs. You don't move a lot, and you just stay still, and administer this nitroglycerin 1 dose only under the tongue sublingual, and call emergency services. Call 911 if the pain lasts more than 5 minutes, and prepare for CPR and AED. Be ready to use an AED only if the person becomes unconscious. And these are everything for the coronary artery disease.